Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm beginning a new series on breast cancer. It's going to take several weeks to talk about breast cancer, which is a very common problem and an extremely sensitive issue to talk about. And according to the American Cancer Society, in 2017, 255,180 women are expected to be diagnosed with breast cancer in this country. And of course, as part of this number, 460 of those breast cancer are going to be men. I'm sorry, 2,470 of that number men also develop breast cancer. As far as death rate is concerned, 41,170 women will die of breast cancer and 460 men will die of breast cancer this year. Very, very, very serious problem. And let me give you an example of, first of all, 30% of all cancers in women are due to breast cancer. Very, very, very common and problematic problem. Let me go over with you the list of the risk of things that can predispose a woman to development of breast cancer. Genetic predispositions, mother with breast cancer, a sister with breast cancer, a grandmother with breast cancer, a maternal aunt with breast cancer, a father with prostate cancer, a father with colon cancer, having ovarian cancer, carrying the BRCA1 or BRCA2 genes, early menarche. That is to say, if a young person, a young girl, have a period between the ages of 8 and 9, that is early menarche. That can also lead to a greater chances of developing breast cancer. Child illness, late menopause, exposure to toxic material, taking birth control pill also can lead to breast cancer. Taking any estrogenic hormone for postmenopausal symptom, etc., can predispose to breast cancer as well. Obesity is also a risk factor for the development of breast cancer. Ingestions of too much red meat, too much fatty foods in general, that can lead to breast cancer as well. And any carcinogenic material that one is exposed to can lead to breast cancer. The list, of course, is quite long. Now, interestingly, I just came across this article on the American Medical Association website yesterday, and I'll try to give you a little taste of what it says. The investigators found that out of 9,856 patients they analyzed, the risk of breast cancer was 72% in the age of people who have women who have BRCA1 by the age 80. 72% of these women are scheduled to have breast cancer by age 80. And for those who have BRCA2, 69% of them were scheduled to have breast cancer. Okay, now the risk of ovarian cancer also by the age of 80, 44% of these women who have BRCA1 can have ovarian cancer, and 17% of those with BRCA2 can have breast cancer. This article is going to come out in JAMA, I suppose, sometime this week. So here's the deal. Breast cancer is much more common in white female as compared to black female. However, the death rate is several times higher in black female from breast cancer as opposed to white female. You say, well, how so? Well, many reasons. Number one, they almost always black female will present to the doctor. Not all of them. There are always some exceptions, but many of them will present to the doctor with a disease that's already in an advanced stage. That's one issue. And that makes it harder for the doctor to cure the disease. The second is that the incidence of obesity is high in both white female and black female, but it's higher in black female. And obesity really is a major risk factor for breast cancer. And another issue that really plays a major role in the higher incidence of death in black women compared to white women from breast cancer is the fact that we have a subgroup of black women who are younger, between the ages of 35 and 40, who are obese. And almost always these women present with estrogen negative and progesterone negative type cancer. And those kind of cancers are much more difficult to treat. As I proceed with the discussion regarding breast cancer, I will explain to you fully what those markers are in terms of estrogen, progesterone, HER2, and BRCA, that kind of stuff. In this segment, I'm just going to introduce you to the subject and give you a general idea what is in fact going on. Well, the first thing is the fact that there's all sorts of recommendations being made in this country, as I'm sure around the world as well, how to go about evaluating women for breast cancer and at what age you should start. Well, I have a lot of respect for these academic physicians. I happen to be one of them who come up with these very sophisticated recommendations, etc. I read them. Sometimes I agree, sometimes I don't agree, but that's neither here nor there. Suffice it to say, you have to individualize. In the almost 40 years that I've been in private practice, I have diagnosed breast cancer in women in their mid-20s. Okay, in the mid-20s. So you really have got to know who it is you're evaluating, who it is you're practicing for. What is the genetic profile of the individual, what's the familial connection, etc. So when you see these recommendations being made, you have to take them in context. Now, what is extremely important for women of all ethnic groups to do is to get into the habit of self-examining themselves. For women of childbearing age who are still menstruating, it is recommended that they examine the breast during the time when they're having the period. That's when there's a lot of estrogen circulating around. The breast is better engorged, and they're more likely to pick up an abnormality. Because significant percentage of masses that are picked up, women's breasts, are first picked up by the women themselves, by evaluating themselves. It's very important that these women go in front of a mirror and examine the breast in the bathroom at the time that they are having the period or the the period a few days from coming, while it's on a couple of days after, etc. Because that's when the breast is very engorged, they're more likely to pick up something. What is the use of the mirror? Well, the mirror is very important because quite frequently the woman may have a retraction. That's right. A retraction can best be seen if you're standing in front of a mirror. The retraction is because there may be a mass that's sitting deep in the substance of the breast, and all you could see is a retraction. You could see that best. Also, the advantage of the mirror, they can also see the nipples better, because sometimes that's what the problem is. You could have cancer that's located just in the nipple. Very, very important. And never take it for granted that if you see these things, you ignore them. Do not ignore them. Bring them to the attention of the physician that's providing care for you so that he or she can do the appropriate evaluation. If you see a milky discharge coming out of the nipple and you are not breastfeeding, that is almost 100% of the time abnormal. It may not be breast cancer, it may be an endocrine issue, but don't keep it to yourself. You're not breastfeeding, you haven't just given birth, and suddenly out of the blue you see a milky discharge coming out of the nipple. Those are extremely important things to report to your physician, okay? The physician of your choice, all right? Now, so those are the first steps. Second of all, knowing your family history is crucial. And discussing that, making notes of these things, knowing, did your mother have breast cancer? Did your mother have ovarian cancer? Did your father have prostate cancer? Did your father have colon cancer? There's a crossover. Genetically, you could cross over. You could carry an abnormal gene for develop breast cancer because your father had prostate cancer, and vice versa. So almost report to the physician when they ask you the questions, and all physicians do when they're taking a history for the first time. There's a whole section of that sheet the doctor had in his or her hand that asks your family history. Do it all. If you don't recall all of it, when you go back home, ask family members what they know about the immediate family history. But that is very important, because how we proceed in terms of how aggressive we evaluate your issue has to do with your family connection. Also, the medications that you are taking, very, very important. Some medications are good, some medications are not so good. Some medications have side effects, as I just mentioned to you. If you take an estrogenic type medication, all estrogenic medication stimulate the tissue of the breast. Whether it's natural estrogen, that's why I want to talk about obesity. How do you go from obesity to breast cancer? Well, when you are obese, you are producing too much estrogen. You say, well, how so? Well, you have too much cholesterol ring in your body. You have too much fat. Fat, the first ring of any fatty material, is the so-called cholesterol ring that's the source of all hormones. You just add different chemicals to it to turn into the hormone that you want. Well, the more obese you are as a female, the more of such ring you have, and the higher the amount of estrogen you have in your body. The more estrogen you have, the more you are constantly overstimulating your breast, overstimulating your endometrium. That's why cancer of the uterus, which I'll talk about at one point when I'm done with the series, before I finish with the series, is highest as well in women that are obese for the same reason. Overstimulation of those tissues then can lead to development of breast cancer. And of course, I don't need to tell you, you read the statistic, came out last week. United States of America is number one of all, not only now of all developed countries, we used to say, now it turns out of all countries in terms of obesity. Why? Not only that, because we have too much food to eat, but we eat too much junk food. Food that are too numerous in fatty material, salt, and simple sugar. Too much simple carbohydrate. And of course, people are in a rush, a tremendous pressure to make a living, going to school, 2-3 jobs, and then they just don't have time to take the time to cook a proper meal. They eat whatever they can put their hands on. Those foods, they're quick, but they're not healthy food. They're not healthy. And don't let anybody tell you they are, because they're not. They're not healthy food. And I'm not saying anything negative about anybody's food. This is the United States of America, free enterprise. People have the right to sell the product. It is the public that also have the right to know what these products can and cannot do to them, positively or negatively. That's all I'm going to say about that. Okay, now, so therefore then, knowing the family history, knowing the work that you do, the exposure of the work we do, that's right, very, very crucial, because certain work that you do can expose you to certain toxic material. And those toxic materials can then cause you to develop cancer of different types, including breast cancer. Okay? So it is crucial that you know these things. Habit, social habits, smoking, drinking too much alcohol. All these things are not good for you. Okay? They're not good for you. Eating too much red meat, as I just listed for you in this list. Why is that bad? It's bad because red meat has a tremendous amount of fat in it. You can't eat red meat without it having too much fat. That's parts of what in the red meat. Well, that's the problem. You're getting in too much of that stuff into your system, and you are exposing yourself to having diseases down the line. And then I'm applying this to both men and women, not just women, because 2,470 men this year, according to the American Society, will develop breast cancer. And 460 of these men will die of breast cancer. For a reason that is still not clear to me after these many years, breast cancer in men is a very, very aggressive disease. Very aggressive disease. Extremely aggressive. So when I make this statement regarding diet, it applies to both men and women. Okay? To both men and women. When I make the statement regarding obesity, it applies to both men and women. Because it doesn't matter about the sex you are. If you're obese, you're going to develop medical problems with an S, because of the obesity. Okay? No one should have the right to act in a negative way toward another individual because they're obese. That is disgusting. However, it is advisable, even I'm not here to give you clinical advice, but it's available in general, to try the best you can to exercise, to eat more fruits, more vegetables, more complex carbohydrate. This particular list book here, The Art and Practice of Modern Clinical Medicine, I believe chapter 4 is on obesity. I have sheets, several pages of the different foods that are good for you, the different foods that are bad for you. Okay, so again, I write the book, I teach this stuff, but I know realistically that's not always the case. As I mentioned last week, and I'll remind you again this week, poverty is still quite rampant in this great country of ours. Take a look what's happening in Appalachia. Take a look what's happening in the poor communities where the black folks and the Latino folks. It's a struggle. The Native American. It's a struggle. It's a struggle to get by from day to day on a meager diet, and people are living basically on food stamp, and it's brutal, absolutely brutal. And you ask, well, the way out of it. I have no idea. All I knew is that in the early 60s, when I got in this country, there were a lot of opportunities still available for young men and women to get out of this stuff, to get out of this condition. That's how I got out of it. I didn't get out of it in any other way. I got out of it using brain power. But there were situations available. For instance, in New York City, there were night school. That's right. We go to school at night. That's how I got started, going to school at night. We had colleges at night. We had adult education, I think that's what they call it. There were high school at night. I'm sure they probably still do now. So you work. Don't just work and get a paycheck, go home and sit in front of the television and do nothing. That's not going to get you out of the situation you're in. You should use the job that you have as a stepping stone to get you ahead. I know that not everybody is able to do schoolwork with ease, but even if you can do it, try. Keep trying. There are people out there that will help you. Teachers will help you. As long as you're willing to make the effort, there are people out there that will tutor you, that will help you to try to get you out of here. Let me tell you something. When I walked around the street, I don't walk around the street with a placard in my back that says that I was an honor student. I was, but the placard doesn't say. All they show is that I have an MD degree and I'm a professor. Well, you know what I mean? So it doesn't matter. You just have got to go for it. But if you sit here, allow time to pass by, sitting in front of the TV, watching whatever it is you're watching or doing whatever non-productive activity that you get involved in, the times are adding up. Times are adding up. You're not going to get anywhere. And the only most effective way to get out of poverty, it is not a shame to be poor, but it is disgraceful not to do anything about it, because you can't. That's right. You can't tell me that you live in the United States of America, that you're getting a job, even if the job is paying you, like my job paid me $1 an hour when I was working at the Manhattan Industrial whatever you call it, center downtown. And I was able to get out of it using going to school. I worked 3 jobs, and I went to college. Let me repeat that: 3 jobs, and I went to college. Okay. In fact, I worked while I was in medical school. While I was in medical school, I worked at Jacobi Blood Bank, and I worked at the Albert Einstein College of Medicine laboratory. I was in medical school the first 2 years. Okay, so, and you can't get any rougher than medical school. I mean, it was brutal. I see the young men and women right now, they're so brilliant, and they're still struggling because it is rough. And I had to deal with it, and I had to compete with these young women and men, because in my days, everything was corrected on the curve. When I went to school, the folks that I was competing with at Einstein, you can get 90 on an exam and don't pass. I'm not making this up. You could get 90 on an exam and don't pass because you fall below the curve. This is crazy. This is the people I had to deal with. Their English were better than mine. They were younger than I was. And I had to compete. And I competed successfully. So don't give me any excuses. You can do it. So that you can, and it has everything to do. Believe me, the statistics just came out a couple of months ago. I think maybe a month ago. The poorer you are, the sicker you become, the earlier you die. I'm serious. You just check it online. Just came out. The poorer you are, the sicker you're scheduled to become, and then the earlier you're scheduled to die. That's right. So it is serious business. You're talking about life and death situation here. Because when you're poor, you don't have money to eat the proper diet. You don't have money to pay the physician to provide medical care for you. You don't have money to have the right insurance. You don't have money to buy the proper medications. And you suffer. It's not a shame, but why stay in that situation? People are traveling, swimming across the ocean to try to get here in order to try to make a better life for themselves and their family. So do the same thing. So I'm not here to preach or preach or pontificate, but I'm just telling you it is sad what physicians like myself and all physicians have to see and deal with on a daily basis when people some of them make tremendous effort. I congratulate them, but some of them making no effort to better themselves. So you wind up with all this stuff, okay? And then breast cancer is a brutal disease, but it is curable if it is found at an early stage. Then that gives us physicians a better chance of helping you to cure this bad disease. Okay, so now the way to go about detecting breast cancer is to have, first and most important of all, your family history. You go to your physician and let your breast be examined by the physician of your choice to make sure that nothing is palpated. Nothing is palpated by way of a mass or a lump of some kind, okay? And if that's done, then from there, the doctor will know what to do, which is evaluating you, sending with different tests that I'll be getting into. So that's one thing, okay? The examination is very important, okay? You have a lot of ladies there. There are a lot of lady physicians, a lot of OBGYN physicians, a lot of breast surgeons who are female. You feel more comfortable with them, let them examine the breast. And then you're going to wind up doing mammogram. That's right. The tests that are available to evaluate the breast are physical examination of the breast, mammogram, ultrasound of the breast, MRI of the breast, digital mammogram, so on and so forth. These are the things that are available. These are non-invasive things that are available to evaluate the breast. Okay, and the physical examination is very important. The patient, the lady examining herself, is also extremely important. Because sometimes, as I said, very frequently, it is the woman that will come and say, "Doc, I felt something in my breast," or "I have a pain there in the breast," or "something is just not quite right," or "the nipple doesn't feel right," or something like that. Then the doctor will have his or her assistant into the room, get the patient properly prepped, and then carry out the examination. But if that doesn't show anything, you don't necessarily stop there because she's feeling something. So right away you get the lady to get herself a mammogram together with an ultrasound. The ultrasound is very important because the younger the woman, the more dense the breast tissue is likely to be. The more dense the breast tissue, the more cystic it's likely to be. So you have a lot of cysts in there. So the ultrasound will help you to discern whether these are cysts that are being seen as cystic breast or this is an isolated mass, so on and so on. It is very complicated. And of course, depending on the family history, sometimes you may go right away for an MRI because you know the mother had breast cancer. You know the aunt had breast cancer. So therefore you're watching, very closely watching this particular lady at a very, very early age. You're constantly watching to make sure the mammogram is done. This is why I say when people make these fancy academic recommendations, you have to take it in context. You have to individualize the situation. It is not, you can't apply everything across the board to every woman. It doesn't work like that. So you have to take the time to ask the right question, carry out the right examination. The age is important, but it's not as important as you think it is. But if you put it in context, then you're likely to pick up an abnormality in a lady's breast at an early age when you could do the most for them. Okay, you could do the most for them, and that's the way it is. There's no magic. You just have got to go through the problem of doing it the right way. And then from there, we'll see what happens. Listen, I'm going to stop here. I have weeks to talk about breast cancer. Until I see you again, this is Dr. Alcena saying so long and bye-bye.